Yeah, I think, Arden, did you have a?
I was going to say that in the cancer literature, it's actually very similar, which is amazing to me. About somewhere, depending on the patient groups, 50 to 70% of patients who are referred for chemotherapy, who need chemotherapy to extend their survival, don't use it. Yeah.
Right.
Yeah.
We went on to an electronic prescribing system about a month or two ago, Dr. First, which we will have through at least next summer when we go to an Epic type system. Anyway, for those of you who don't know, there's several pages on Dr. First. You're usually looking at the prescribe page, but there is another page where you can actually see their pharmacy prescribing data. That, assuming that they have health insurance and that insurance plan is kind of linked with Dr. First, but you can look at that and you know, when she was giving some of that, I thought probably some people are thinking, oh, our patients aren't that bad, but you know, if you look at some of that data, it might be, you know, interesting. And then the other thing is, it is interesting to ask people how they're taking their medicine. The physicians here have been very slow to adapt to changing their prescribing ways, so we still have a lot of people prescribing methylamine 3 and 4 times. Please stop doing that.
Right.
But also, patients sometimes think they have to give themselves pills like they're given in the hospital.
Right.
And that one chart was really, you know, illustrated that. But I've talked to people, and I'll say, you know, and how much sleep are you getting? And, you know, is it well, you know, I have to be up at 12 to take my you know, last dose of prednisone, or I have to be up at 6. I'm like, why are you taking? You know, they're taking like 6-2 and
right.
It's
Right.
crazy. So
right.
really
Instead, Q8 as opposed to TID.
Yeah.
Right.
I mean, people do really extreme things sometimes.
Right. Right.
Do you think patients believe that blood tests will detect whether they're taking azathioprine or not, and that may influence them? They don't want to be caught. I mean, azathioprine is the highest.
Right. I don't
I'm
think
also
so
afraid to
much.
ask them, but
Right.
I don't want to blow that if that's helping me.
I don't think so.
Times where you'll tell a patient, I'm going to check your azathioprine levels today. And the patient then doesn't say anything to you. And then 10 days later, when the nurse calls them and says, your level was really, really low, were you taking your medicine? Had you run out? Oh, I had run out about 5 days before. Is there a reason you didn't tell that nigga that? I mean, I don't know.
They don't want to get caught. They don't want to be the bad guy.
Right. But if we, you know, start with the conversation, hey, you know what? How's your medicine going? Then they may feel a little bit more open and comfortable about talking about it. All right. Well, thanks so much for the